Jaw pain is oftentimes a result of something else going on inside your body. It actually oftentimes starts at your pelvis, and the alignment of your pelvis really matters. And that actually, the alignment of your pelvis really mimics muscles up in your head and in your jaw. So when you have a rotation in your pelvis, you have a tight hip flexor, maybe you need the hip hook or other tools to help align that. That helps put that in good alignment, which allows your spine to be in good alignment, which allows your head to sit on your spine properly, which then allows your jaw to be in alignment. One of the primary reasons why people experience muscle tension is because your body is trying to protect or hold an area that's either unstable, that's out of alignment, or that it's experiencing some kind of stress. So you can imagine if your head is not on properly and your jaw is not aligned, that would be a really great reason for you to develop, let's say, jaw tension in one area of your jaw. The other thing that's really important for jaw alignment is tension in through your pecs and the base of your skull, which is why I love the knuckle for working with jaw issues. When you have tension in your pecs, it pulls your shoulder forward. And so you can use the knuckle to release that up against a wall. But that pulling forward motion actually starts to activate some of these muscles on the front of the neck here. And then those muscles in the front of the neck then pull on the jaw, pull on the head, and kind of pull things out of alignment in such a way that it starts to aggravate the jaw. The jaw is happiest when everything is symmetrical and aligned and it's sitting right into that joint and there's no muscle tension pulling on it or tugging on it. So that's what we want for the jaw. But you can imagine if this is rounded forward, then all these muscles here at the front start to tighten up, and then they're pulling on the jaw and making that not a good thing. Similarly, tension at the base of the skull, right here, I can show you this on this model, these teeny tiny muscles here, when those become tight from a forward head, rounded shoulders, then that is changing the alignment of the skull. This is your skull on your neck. So that gets shifted. Could even be like maybe there's tightness on one side versus the other, which is very common. And that tension would pull on the skull in such a way. So the skull is this way, the jaw is this way, and then you end up with imbalances and then muscle tension develops. So the jaw is actually the last link on the chain, whether you're talking about your pelvis working its way up the spine, or you're talking about tension here and here and it working its way up. It's actually a manifestation of something that's going on somewhere else, right? So you really want to make sure that your core is in great alignment and relaxed, as your primary core and your secondary core are in really good alignment and relaxed. So when you use the knuckle, you want to first make sure that the base of the skull is released and your pec. So you'll be using your pec up against the wall, and they've got tons of videos on that. And then you would be using the knuckle on the ground. Let's see. To release the muscle tension at the base of the skull. I know my hair is probably not in the right place. Using the different tips to find out where you're most tight. You're going to, likely if you have jaw issues, you're going to find that one side is tighter than the other because that's what's pulling your head, your skull, out of alignment in relationship to your neck. So by kind of tilting your head side to side, you can discover as you're moving it up and down along your neck, which area is the tightest, and playing with the different tips too, different distances apart too, to make sure that you find that area. Once you find that area, like I talk about, you want to hold that pressure to get that muscle to release. And I've had quite a few people in my clinical practice as a physical therapist for over 20 years now, who I've worked on their neck when they come in with jaw issues, and the jaw pain goes away. So I know for a fact that these things are connected. I've seen it in clinical practice. And we've had a ton of testimonials come through so far on the knuckle of people with similar situations, not even knowing that this actually does address the jaw by working on the neck, but noticing that their jaw pain does go away after using the knuckle on their neck. It's pretty awesome. So I can't wait for you to try it. So anyways, going back to the knuckle, releasing tension at the base of the skull, releasing tension as you work your way down the neck. And then you can start addressing the symptoms. So remember, the jaw is the last link on the chain. that is the symptom. It's not the cause. But once you release tension here and here, then you can go to working on some of those jaw muscles. And you can just, use whether it's the tip that's close together or maybe even this one to lie on your side and put pressure on that masseter muscle. So this is the muscle that's right here in your jaw, nice and tight. And then just by leaning and relaxing into that, you can put prolonged pressure on that muscle and get it to relax. And all of these are great to do, like closing your eyes and taking nice deep breaths as you're letting the muscles relax, not talking while you're doing it like I am. Because the masseter is one of the biggest muscles that controls your jaw, and it's very much responsible for tension. And then you also have your pterygoid muscle, which is right underneath your jaw here. And you can angle the knuckle to kind of get underneath the edge of your jaw, the edge of this bone, in order to get in there and release tension there. Oh yeah, that's a good spot right there. So that all happens after you've had releasing to your neck and your pec to get at the cause and then release the symptoms. I look forward to hearing about your successes in using the knuckle for your TMJ.